Good afternoon. I'm Clifton, one of the public information officers for the Office of Emergency Management and Homeland Security in Lorain County. This is kind of a wrap-up for the weekend of our first case of H1N1 influenza. It used to be called swine flu, but now the CDC and the Ohio Department of Health prefers that we utilize the new name. And based on the updated recommendations of the CDC, Superintendent Paul Richter closed Ely School for another 7 days. The current revised recommendations are that schools close for a minimum of 14 days when there's at least one case of confirmed swine flu. Just an update on what our progress has been. We had a 41-year-old woman who had been seen at St. John West Shores Hospital, and she has tested negative for H1N1. The test results for our 17-year-old female who was seen at Amherst Hospital and our 44-year-old man who was seen at Elyria Memorial are not available from the Ohio Department of Health, and none of these pending cases had any connection with our 9-year-old Elyria third grader.
All along, the CDC has recognized that children may be infectious for a longer period of time than the standards we were talking about for adults. And I think that makes sense if you think about their activity and how they behave. And today they actually came out and committed to a time period of 7 to 10 days as the infectious period. So that's the basis for the extension of school closure.
And so that recommendation comes from the CDC to the City Health Department to the school district? Is that the chain of command there, or how does that work?
It's essentially how we communicated it, but yes, the CDC information went out all across the country today with their daily updates, sometimes multiple updates per day.
Okay. Tell us what the last week has been like. I guess the last 7 days, considering this all kind of got underway last Friday.
Well, it's been a very hectic week since the first phone call about the potential first case. And Sunday was a very exciting day for us as we had confirmation about the case, and we were working hard as a team here at the health department to put together a press release and to work with the schools to get the information out and to try to do so before the White House press conference was scheduled.
What happens with the school now? I mean, does it just stay closed? Is there more disinfecting that takes place, or what's the... Do you want to answer that one, or do you want to keep your...
There's no need to further disinfect the school. They did everything they were supposed to, and there certainly is no recommendation from the CDC to do any wall washing or ceiling washing or anything. What they did initially was exactly what they would have done had they opened on Monday, was make sure that desktops were added to what they normally do. They normally do bathrooms and kitchens, so there was no need to do anything else, and it's just going to stay closed.
Okay. I guess the big thing that you guys were saying when we came in is you don't want people to panic.
Absolutely. This is just an extension of a one case in a school, recommendations from the CDC. They really recommend the longer closing. That's exactly what it is.